If you look at the question, it explains that pulse wave Doppler is being used. Here, it is asking about the possible outcomes when the length of the sample gate is increased. Usually, when performing an ultrasound examination, you position the sample gate like this to obtain velocity values. This question is asking what changes occur when you widen the range of this area. If you look for the correct answer, you can see that option B is the answer. You can say that spectral broadening can appear in the spectrum itself on the image. Let me explain this further while watching an additional related video. The image you see at the top is a spectral image obtained using pulse wave Doppler. As you can see, you can obtain information about the blood flow waveform in this way. Among these, the area here is referred to as the spectral window. When you obtain the blood flow velocity using a sample gate value of about this width, you get a typical waveform like this. On the other hand, if you widen the size of the sample gate here, the amount of blood flow signal information you obtain increases. If the blood flow signal is measured at a higher level like this, the spectral window in the middle can become completely filled in this way. This change is referred to as spectral broadening. To summarize, usually a sample gate of about this width is used, but if you set this part wider, the color of the displayed spectrum will also change. Additionally, as a reference, spectral broadening like this can also appear not only in smooth blood flow, but also when turbulence is formed due to vessel narrowing. Just like a whirlpool, when the rapidly flowing blood velocity is displayed, spectral broadening can likewise be observed. So keep in mind that spectral broadening like this can appear when measuring a wide range of blood flow velocities or when measuring turbulence. Let's move on and look at the next question. This time as well, it is explained that a pulse wave Doppler is being used. What the question is ultimately asking is which technique is unrelated to avoiding aliasing. If you look at the options, one is increasing the velocity scale. By increasing the scale, you can include a wider range of velocities, so this is one of the representative techniques used to eliminate aliasing. Option A is correct. Option B is decreasing the Doppler transmit gain. This technique is not directly related to reducing aliasing. Adjusting the Doppler gain is only used to control the brightness, such as making the image appear brighter or darker. It is not directly related to obtaining higher or lower signal itself. You can just think of it as a concept related only to how bright or dark the image appears. So the incorrect answer is option B. Next, looking at option C, it says to decrease the image depth. If you repeatedly go through areas with greater depth, the PRF value, this value, will decrease. When the PRF value decreases, the Nyquist frequency also decreases accordingly, which can result in aliasing occurring. On the other hand, if the depth decreases, the time it takes to go back and forth becomes shorter. As a result, there is a change where the PRF increases. When the PRF increases, the Nyquist frequency also increases, and as a result, aliasing is eliminated. Therefore, reducing the depth in C mode is a concept that is directly related to this. Similarly, option D is also a concept related to controlling aliasing. The incorrect answer is option B. Let's move on and look at the next topic. Now, the question is asking about sweep speed. When performing an echocardiogram, the question is asking about the standard value used for sweep speed in M mode. The correct answer is option B. Generally, a value of around 50 is used. Here I will additionally explain what changes occur when the sweep speed value is increased or decreased. If you look at the illustration, this one shows the value set low. The illustration next to it shows the value set high. As you can see in the video, when the value is set low, you have the advantage of being able to view multiple spectra as a whole. On the other hand, when the value is set high, you have the advantage of being able to zoom in on just one of the multiple spectra. So, when looking at the overall spectrum, for example, if we assume that the patient has arrhythmia, we check whether the heartbeat is functioning normally. In such cases, since you need to look at the overall spectrum to identify where the problem lies, you can use a low speed setting. On the other hand, if you want to measure a specific value among these, it is more efficient to set a high speed for tracing and measurement like this. Therefore, you should understand that you can appropriately adjust these settings according to the examination environment you want and the measurement values you wish to obtain. Let's move on and look at the next topic. In this question, it is asking which of the following is not related to improving lateral resolution. First, if we look for the correct answer, we can choose option number 4. If you increase the diameter of the probe, the beam width will also increase accordingly. When the beam width increases, the lateral resolution decreases, so option number 4 is an incorrect choice. The other options, such as increasing the focus, increasing the frequency, or using harmonic techniques, are all related to improving lateral resolution, so it would be good to review these basic concepts once again through this question. Let me provide some additional explanations while watching the reference video. The beam width is formed like this from the transducer. If two structures are present within this beam width, the image cannot distinguish between them and will display them as a single entity. That's why in the section where the beam width narrows, in the middle, as you can see, the beam width is narrower. When the beam width narrows like this, it becomes possible to distinguish and display each structure separately in the image. In this way, depending on the direction of the beam width, each structure can be distinguished, allowing you to obtain an image with good lateral resolution. The important point is that the narrower the beam width, the better you can distinguish these small objects. To reduce the beam width, the diameter of the transducer must be decreased, so you can consider that this aspect changes accordingly as well. Let's move on and look at the next question. This question is asking about something directly related to dynamic range. The correct answer is compression, which is option C. These two are basic keywords that are always paired together. You can organize your understanding of the content through solving this problem.